Well, to be fair, Dan Andrews does have compassion. It's just that he focuses more of it on the gay lobby, which was obvious when he joined a gay pride march this year, than he does on, say, people protesting the withdrawal of their fundamental freedoms, who in 2021 were met with police dressed as stormtroopers shooting them with rubber bullets. The evidence that the policies trotted out during the COVID pandemic are among the worst in Australian history is starting to become abundant. Last week, the Australian Bureau of Statistics released the mortality figures for February this year. There were 12,736 deaths that month. There are two comparison points for this. One is a baseline average for the years 2017, 18, 19 and 21. These are considered relatively normal years, unaffected by the direct and indirect consequences of the COVID pandemic and lockdowns. So, compared to this baseline average, February of this year was 8.9% higher. This is curious enough, but it is also lower than the figure for the previous February. One explanation for this could be that February 2022 was a few months after the most intense phase of the vaccine rollout, and that adverse reactions to those vaccines were at their peak. Drawing a link between excess deaths should be easy, as the great Senator Gerard Rennick pointed out in a Senate committee in November last year. He asked representatives of the Australian Bureau of Statistics this.
Is it possible that you can track those deaths by vaccination status, number one, and then track between the time of death and the time of vaccination?
To which the reply from the Australian Bureau of Statistics was,
in terms of tracking the vaccination status, that would require analysis of microdata, which is available. There is the Australian Immunisation Register has been linked to an integrated data asset which goes by the name of MADIP, which is a people-centred integrated data asset. And so it would be possible.
It would be possible. The ABS then promised to send that information, linking vaccinations to the time of death, to Rennick. Remember, this is information that could shine very bright light on why Australians are dying in record numbers. But Rennick's office told me today that the ABS is now simply refusing to provide the statistical breakdown. On the weekend, another quote from the weekend, the World Health Organisation boss, Tedros said this.
In the past 2 years, we have witnessed the fastest and largest vaccination rollout in history, which has been critical to ending COVID-19 as a global health emergency.
Wrong. COVID wasn't a health emergency. Worse, the vaccines caused more harm than good. The frightening thing is that Australian governments are in the process of ceding sovereignty to Tedros World Health Organisation, which will then dictate our response should there be another pandemic. And you can bet there will be. Journalist Adam Crichton, one of the sanest voices on the issue in Australia, has a scathing piece in today's Australian about our politicians deferring to the World Health Organisation. It ends with this quote: "Unless the measures imposed during the COVID-19 pandemic and the way they were introduced are condemned as a mistake made in panic, we will have passed a turning point in Western history, one that has ushered in a more intrusive, utilitarian, even totalitarian system of government throughout liberal democracies."